Wow, what a long break. I'm your host, Dr. Festus Osai, the National Coordinator of the Medical Ultrasound Forum. The Medical Ultrasound Forum is a professional group of medical practitioners in different subspecialties in medicine and also some paramedics who are in the interest of ultrasound scan. What we do, we learn ultrasound scan, we teach ultrasound scan, we research on ultrasound scan to promote the knowledge here in Nigeria. We have over 280 members and the number is still expanding. Although for you to become a member, someone has to recommend you to be a member of this wonderful group. So you're welcome. Now, because of some certain situations and some certain demands, we're going to talk about something very, very important. Talk about ultrasound assessment of cervical insufficiency in ultrasound scan. There was a time I shared a video of a patient, a couple that came just wanted to know the sex of the baby. I think about 16 or 17 weeks or so. So we did an ultrasound scan and we discovered, of course, the service was already open. And we counseled them to rush back to the facility and do a satellite. They went back to the facility and the doctor saw them and was not convinced that it was not a case of cervical insufficiency because they've never had previous history. Of course, he sent the scan result elsewhere and they came out and said the service was normal. The house was closed. What happened? In the next 24 hours, she lost the pregnancy. Now, how do they make such a mistake? I don't want you to make such a mistake. That's why we're going to talk about something interesting. Ultrasound assessment of cervical insufficiency in ultrasound scan. You can share the videos amongst your colleagues and your peers so that others can learn. We are here to teach, to learn, and of course, we are open to comments and of course, criticisms. Well, don't worry, our Zoom training exercise is going to comment this week. For the end of this week, we're going to do a free Zoom ultrasound training to be sponsored by Juve Mindray. So be ready, stay tuned. You're blessed. Thank you very much. Now let's look at this. We're going to look at the ultrasound assessment of cervical insufficiency in scan. You want to think, good, let's make it this way so that it will be much bigger for you to appreciate. Now, that's focused very well. Thank you very much. So now, what are things we're interested in here? For example, well, before I go on, just remember my book is all over the country. You can place your order from these different numbers displayed on the screen. It's a 340-page medical ultrasound book in ultrasound scan, obstetric ultrasound scan. This is the first edition, and of course, this second edition is available right now. It's a wonderful book, and I encourage you to get your copy now. Let's look at some of them have asked me, why am I doing what I do? Why do I like taking people to ultrasound scan experience? Why do I like doing training workshops? Like we've done over 10 workshops in 10 different states in Nigeria: Abuja, Lagos, Port Harcourt, Calabar, Benin, Enugu, Kogi State. We've done in Mina, all the way in Mina, and some other states too. About 10 of them we've done across the country. Well, I am I'm a physician and medical practitioner, and from the paragraph 10 of our physician's pledge, what did it say? We all say, I will share my medical knowledge for the benefit of the patient and of course the advancement of healthcare. And this has been one of my major stimulant, or rather situations that push me forward to teach. I love teaching ultrasound scan and I love sharing the knowledge of ultrasound scan because it has done a lot for a lot of our doctors today and they are quite happy. And of course, lives has been saved. So if you want to ask me again, just go through this and you know the reason why, the motivation, or where the motivation is actually coming from. Now let's just go through briefly. Going to go through that. We'll look at the introduction, talk about types of scan, how to assess the cervix, the principles are needed to diagnose and the incompetent cervix from say it's not insufficient, cervical insufficiency. Then we'll look at the stages of progression of cervical dilatation. The conclusion, of course, references for those of you that want to make some certain references. Now, we all know the cervical incompetency or rather insufficiency is a situation whereby there's a functional weakness in the cervix. And what happens result to the inability of the cervix to achieve term pregnancy. Okay, that's where, and it can result to what's called spontaneous dilatation, effacement, and of course, without even uterine contraction, and the baby is lost along the line. And it happens around the mid-trimester. You know, and the teaching is that once a woman has habitual abortion during the mid-trimester, habitual abortion, cervical insufficiency. But what of a woman that does present for the first time and is in the process of losing her pregnancy? Do you just send her away or ask her to lose the pregnancy before you make a diagnosis? No. Do a scan for her so that she don't become a victim of habitual miscarriage before a cervical and medical intervention can be done at the end of the day. Now, let's just go and look at the different types of scans that we can do to look at the cervix. Transabdominal scan, transvaginal, translabial, and of course, transrectal scan. These two they're not commonly done, but done by people. You have to be trained to have a skill to do that. Transvaginal, I will encourage you not to go into unless you are very, very good at it. Of course, the commonest one is transabdominal view, which is the one we are really going to focus on in this training. Now, what are the different ways you must do? What are things you must do? Prepare your patients adequately so you don't make the mistakes of some persons like I mentioned earlier. Prepare the patient appropriately. Position the patient. You understand the landmarks, what we call the anatomical landmarks, to identify the cervix. And of course, you know the ultrasonographic anatomy of the cervix in terms of the length of the cervix, and of course the appearance of the cervical canal and its relationship with that of the internal os. Now, of course, you have to appreciate the different stages of what dilatation is cervical insufficiency. Now, how do you prepare your patient? Of course, we know full bladder is the key, please, and not over descended bladder. Full bladder is the key. With the full bladder, you can see the upper vagina, external os, and then you can get the internal os as well. Then you lie, of course, in the supine position and position exposed to the level of symphysis pubis. Some of you you want to scan your patient, you expose up to this level. That's not good enough. If you're doing a pelvic scan and an obstetric scan and you're not seeing the upper vagina, then there's a problem with that ultrasound scan. You can try it and you see. I know some will say, "Oh, don't. I will convince you later." Now, talk about placement of the probe. Your probe must touch the level. You must touch the symphysis pubis. And when this happens, definitely you see the upper vagina, you see the external os, you see the internal os, and from there you cannot do a good and proper assessment of the cervix. Try this and you will tell me thank you later. Now, when a probe is properly placed, what happens? You see this is the upper vagina, it is slanting down the upper vagina. This is the external os, of course, this is the internal os, and this is the cervical canal. Now, what are the anatomical landmarks of the cervix? Of course, we know is the external os and of course the internal os. This is the landmark of the external os, but this is the external os actually here, and this is the landmark of the internal os, and this is the internal os here. Of course, this is the cervical canal. Simple, straight and forward. These are other examples, as you can see. External os, internal os. This is the bladder here, full bladder. You can imagine the two of them. And of course, this is the internal os, which is closed. Now, talk about sometimes you have a case of elongated cervix, where you have maybe previous CS or previous surgery or something in case of what over the urinary bladder. In that case, the cervix is so much stretched out. But of course, you can still identify the cervix as well, as you can see in these two cases on display. Now, talking about other things you need to do. What are the ultrasonographic anatomy of the cervix? Length of the cervix is important. Okay. Now, the normal length of a pregnant cervix is between 3 to 5 centimeters. That's our concern. Let's not forget about the non-pregnant cervix. What it means is that if the cervical length is less than 3 centimeters, then you need to start thinking of raising the red flag or see what you can do at that point in time. Of course, a closer follow-up scan may be necessary before you can also conclude. Although there's some things you see, you don't need to wait for further monitoring, but rather an urgent intervention that will go on as well. Now, look at this. How do you measure the length of the cervix? The length of the cervix can be measured. This is the bladder here from the external os to the internal os. This gives you the length of the cervix. Like I said, between 3 to 5 centimeters. Sometimes you can have an elongated cervix of 5.6, 5.7, like I said earlier. Over the bladder, previous surgery, those can kind of elongate the cervix, but that's not something to bother about right now. Okay, now, so this is the cervix. So you can see from here to here, from here to here, that's learn how to measure the length of the cervix. Mind you, I didn't say this way, take notes, but rather this is the plane of the cervix you follow as well. Then what are things you need to look at as you're scanning? You look at this, we talk about the next ultrasonographic anatomy you need to consider in assessment of the cervix is the relationship between the appearance of the cervical canal and that of the internal os. It will have what we call a T-shaped appearance. Now, this is the bladder. This is the plane of the internal os. I see that's what we call a T-shaped appearance. So if it's not a T-shaped appearance, you have to start looking out for other things and see could this be happening, whatever is happening. Now look at this. Another way to look at it again is what I call the wine glass appearance, where this is the bowl of the wine glass. Look at the lower end of the lower part of the uterus. I don't want to call it lower segment because it's still early pregnancy. The lower end of the uterus, and of course this is cervical. This is cervix, the cervical canal. So you can see there's no connection between the content of here and here. No connection between the content of here and this place. So you can see why this can also be described in this regard. Now, transvaginal scan, I don't want to bother about it. Like I said, just leave that. That can be done later. What are the different stages of cervical dilatation when we try to observe a patient with incomplete cervix? We have the Y-shaped stage, the funneling stage, and the cup-shaped stage. Now, in some school of thought, some people see only the Y-shaped stage and the cup-shaped stage. It's still okay. But I prefer categorizing 3 so I can see if it's a certain progression from one stage to another. That's why I still prefer Y-shape, funneling shape, and of course the cup-shape stage. Now this is a Y-shaped stage. How do you describe a Y? A Y is a fiber that has what 2 short arm and a long tail, like you can see. Now this is the Y here. You can see this place is already open. This is the Y, the short arm and the long tail. The tail signifies the length of the cervix that is still what available. And if you want to measure the length of the cervix available, you have to measure from here to here, not from the level of what? The internal os anymore. Although some women would have parallel cervix may have situations like that will not progress, that was a problem. But when you see this one, it's good to say, okay, do a follow-up scan and see there's a progression from one stage to you know that actually this is a case of cervical incompetence, because sometimes they can even progress to what you call the V-shaped stage for the Y-shaped stage. You can see, like in this case, this is the V-shaped stage, like a V of funneling shaped stage where you have two long arms and sometimes you have a tail or no tail at all. You can see this is a V-shaped stage. You can see there's a difference between the Y-shaped stage and the V-shaped stage. So this is actually progressing along the line. This is the transvaginal view. I don't want you to bother about it. Now the third stage was the cup-shaped stage. Now the shape of the cup is defined. When you see the cup shape, you just know that the amniotic sac is already in the cervical canal, giving you that cup-shaped appearance. In this case, if you just put your suture there, of course, you rupture the membrane and that becomes another complication. If you do a result, you see, you likely see the opening of the os with the membrane looking at you, staring at you. And so this is the cup-shaped stage. Now, situation, this is another example of shape stage. You can see that, and there's a cup-shaped stage. Both the external os and internal os are open, and the shape has become the cup shape or U-shape appearance. In some situations, you might even see it as you put your probe. The amniotic sac is already what? In the vaginal canal, like as displayed in this case. Sometimes you can have a very tempting situation whereby you have a cup-shaped appearance, but there's still some level of closure in the external os, like in this case here. So if you measure the length of the cervix just from here to here, and you'll be tempted to believe that it's from here to here. No, this is the length of the cervix. So please, I will always say that anytime you're checking the case, when the case of cervical insufficiency, if there's still the length of cervix still available, measure the length of the cervix. It's very important for whoever is taking the management to go forward. They will know whether to go on or not at that point in time. This, I don't want to go bother about this. Now, this is the trans view. Don't worry about this transvaginal view, like I said. You want that, you can come around and teach you how to do it. Okay. Now, this sometimes you have the content of the fetal part inside the cervical canal, like in this case, the foot of the baby in the cervical canal, which can be very bad, but not a good news at all. Now, this is the head of the baby already in the cervical canal. Then sometimes you can see, when you use a Doppler, you can even see. So in some cases, the umbilical cord already, the cord is already prolapsing. You see that in the cervical canal. Okay, now this is same thing, another thing as well. Don't worry, if you don't have a Doppler, you can also pick that, and I'll tell you how to do that maybe in subsequent training sections. Now, this is satellite. It's also important for you to do a post-satellite ultrasound scan. It will tell you a lot about the pregnancy at that point in time. It can even tell you what satellite is done at that point in time, whether it's at the abdominal, whether it's urethra, or rather McDonald. Of course, you can see how well that has been done as well. Okay, I don't want to bother about this, so don't just for the sake of time. Now let's look at this. Let's for the sake of time. Now look at this. This is a case. That's the bladder. The case of post-satellite ultrasound. This is the marks of the miscellaneous tape. Mind you, it's a full bladder. Upper vagina, external os, internal os. This one was done at a level of what? The external os. And this is another example as well. Of course, you do this and say you're rest assured you've done a good job. Wow, sometimes you can have a case like somebody comes to you for ultrasound scan. You notice this. You know, our parents in those days, they had this idea of satellite. You know, they do traditional satellite as well. We're just a digression anyway. Now, we need to conclude. Cervical insufficiency can be regarded as an obstetric emergency. For if nothing is done, it could develop loss of the pregnancy and even preterm deliveries, as the case may be. Ultrasound scan has come to play a very vital role in detecting early cases of death, and of course, a life can be saved as well. You can have your references. You want to read more about it, you can go through your references now. Then I'll say thank you very much. Thanks for listening, and God bless you. Any comments, you are welcome at that point in time. Thank you very much. I'm your host, Dr. Festus Osai.